What is clinical epidemiology? At its heart, clinical epidemiology is the science of linking an exposure to an outcome. Examples of exposures could be anything at all, perhaps smoking, it could be an adverse child experience, it could be exposure to a drug, it could be a laboratory value like HbA1c or total cholesterol. But if we give the exposure as a doctor, we sometimes call that exposure an intervention. Examples of interventions obviously are things like drugs, but there are many non-drug interventions such as physiotherapy, psychological therapies, and complex interventions with multiple subcomponents. Examples of outcomes would be things like clinical outcomes such as mortality or morbidity or the side effect of a drug. Patient-reported outcome measures or PROMs might measure things like quality of life or pain scores. Surrogate outcomes could be a laboratory value, which in turn is associated with a clinical outcome. We might have health economic outcomes, and there are outcomes called composite outcomes, which are constructs made up of multiple sub-outcomes. I would say a few things about outcomes. They have to be measurable. And in terms of collecting a measurable outcome, then the outcome is either a numerical type variable or quantitative variable. And this is a number. It could be height in centimeters, or it could be a number like HbA1c or cholesterol. It could also be a categorical variable. These are categories that could be binary, like mortality or biological sex, male, female, or it could have several categories in an order, like poor, good, or excellent. This matters, the type of variable, in when we try to describe data or perform statistical tests.